So first, let me introduce Dr. Xiaoting Wang and Dr. Chao. They are president and vice president of the CCUST, the Chinese Critical Care Ultrasound Study Group. They also have up 10 years ultrasound using experience around the world, and work so many years with ultrasound to take care of the critical care patients. And so I think Cindy, do you want to say something about this, the target of this meeting, especially for the COVID-19 situation?
Yes, thank you very much. We appreciate very much your attendance, and you're helping us with this meeting today. We want to learn from you as a way to help educate doctors all around the world for COVID-19. We know you have great experience and have learned so much about how to use ultrasound in this illness, and are experts. And so our goal today is to learn from you and support doctors who are really fighting this COVID-19 virus, and help other doctors to be trained in ultrasound to help.
Mm-hmm.
Mm-hmm.
And so what we're going to do is we thought of some questions that we would like to ask you to learn more about how you are using ultrasound, and really just kind of learn from you about that. So if it's okay with you, then I will start with one of the first questions. What would you say with ultrasound is the main use in management of patients with COVID-19?
We published our consensus papers in China, and also we translate that in English version. So the main author is Dr. Wang Xiaoting. I think he has a lot of ideas about this. So Xiaoting, can you?
Yeah, I see. As you know, ultrasound is very important in the long duration the management of the patients, especially critical COVID-19 patients. So lots of ICU doctors learned critical ultrasonography. About 10% of ICU doctor can use the ultrasound to manage and monitoring and in the long period of the management of critical COVID patients. So we will do lots of hold lots of course and webinar to help a lot of ICU doctors to use ultrasound and the management and the monitoring and the treatment the critical COVID-19 patients. Maybe we have two methods, two way. The number one is cost series, one by one. So like the first course is the principle and the important key points. Use critical ultrasound, using critical ultrasound to treat the patients and the key points and the principle. The first course, and then one by one. So like how to use in the special circumstance. Just like the top level of protective. Just like mask and glasses. Lots of protective course. So in this special circumstance, how to use the how to use the critical ultrasound. It's a key issue. It's a key problem. It's the second cause. And then how to use ultrasound to management the respiratory problem. And the fourth, how to use ultrasound, how to use critical ultrasound to management the circulatory problem of circulatory problem. And the next cause is how to use the ultrasound to totally to management the critical COVID-19 patients. And then one by one, it's a cost series. And then the second way, I think we will hold a webinar about the key issue, the concerned issue, or maybe the hot issue. Just like if lots of ICU doctors concerned the problem, one problem, and one by one, and we maybe hold a webinar course just about this problem. So I think two way maybe in the very beginning we will hold two way to help lots of ICU doctors to use ultrasound to management the critical COVID-19 patients. That's all.
Okay. Oh, that's fantastic. So you're using it in a lot of different ways and doing a lot of education to help others. And you mentioned quite a range of things there. And so I'd like to ask a little bit more question about when you're using lung ultrasound to monitor the patients. How frequently do you use lung ultrasound?
The frequency, maybe in the very beginning, and then when the ICU doctor faces a new problem, especially the critical problem, just like respiratory difficulty and circulatory collapse, maybe hemodynamic issue, like heart rate increase, blood pressure decrease, and both, maybe both, just like both respiratory difficulty and saturation of oxygen decrease, and hemodynamic collapse. We maybe use critical ultrasound to evaluate the patients and monitoring the patients and management the patients. So the frequency depends on the problem of the patients. Thank you.
Okay. So it sounds to me then in many cases you may be using ultrasound of the lungs themselves multiple times a day. Is that correct?
Because COVID patients is in the very beginning, virus invaded the lung in the very beginning, firstly. So, and then patients got respiratory difficulty and decreasing of oxygen saturation, and then combined with circulatory collapse. So in the very beginning, maybe in the long term of this disease, we use the patient's monitoring and evaluation. The lung is in the most circumstance. So then, especially in the critical COVID-19 patients, in the very, very severe patients, maybe lots of patients got the respiratory failure and combined the circulatory failure, both, and lots of organs organs is organs dysfunction, just like kidney and some of patients the liver, but the lung sorry, the injury, the lung injury, lung injury is always existed. So when use the ultrasound to evaluate and monitoring the critical COVID-19 patients, lung ultrasound in the very beginning, and combined the echocardiography, maybe echo, and then lots of organs maybe needed to evaluate about the ultrasound, but lung ultrasound is very important. Thank you.
Okay, thank you.
I think
yeah, so
the second opinion can
sure.
I can share with you is you know, this question, I think is the answers depend on the different condition. You know, according to the guidance from WHO, you see the patients from the epidemiological investigation. We know the patients in the first stage is incubation period. So the patients don't have any symptoms or signs of the virus pneumonia or something. And after that, patients will develop some maybe cough, fatigue, and fever, something with the patients. But during this time, patients' oxygen situation or the respiratory dyspnea and also hypoxemia is not happen with the patients. So during this time, I think the most important part is focus on something happened in the lung. So in that time, we, as a doctor, you have to see what happened with your patients. Is patients, you know, most of these patients is have a very favorable prognosis, but some of the patients, I think about 10% of patients will become more worse. So we focus on this point. We try to figure out what kind of patients will become more poor prognosis. So we try to use some kind of examination or maybe X-ray or CT scan or the other laboratory test, or even follow patients the course of the disease to try to separate the different team or something. So in this phase, we use lung ultrasound to follow patients. It's more easier. You know, in Italy or even in China, Wuhan, and that time is, you know, it's a huge patients entity, makes the doctors or our medical staff or even resources very difficult to get this point. So we use lung ultrasound. If you can give this kind of machine to the first line medical staff, that makes something more easier. You know, some people now is and from the other point of view, we from the pathology to clinical. You know, in this first stage, as Dr. Xiaoting mentioned before, the patients, the first stage is the virus just injury the lung epithelial cells. That means just in a very early stage, the patient's condition maybe is just a little bit fever, fatigue, or cough, or the other thing is little bit short of breath or low oxygenation. So we use some monitor to monitor the oxygen situation and the maybe breath rate, and then we use lung ultrasound to monitor this. But after that, I think you also saw that just published intensive care medicine. They published some guidelines to focus on the very severe patients. As Dr. mentioned, the patients in the later phase will happen very low oxygen situation, and even circulation part is also worse than before, is in shock condition or ARDS, even the ODS. So in this phase, we not only focus the lung image and also circulation part. So if you want to follow this kind of cause of this disease in the first stage, I think it depends on the patient's science, patient's some non-compliance to see what happened. And the other thing is how many medical resources you have. If you have a lot of staff with the patients, you can do as often as you want. But if you only have maybe very limited resource, I think it's very difficult to perform this kind of examination very frequently. So it's my idea.
Oh, okay. Oh no, that's very interesting. So early on, the lung ultrasound is very important, and you follow the patients with lung ultrasound. And in that stage, you can, I'm assuming then that you will see the lung ultrasound improve, or it may get worse. And so is it then important to compare the lung ultrasound from exam to exam? Or do you remember, or how do you compare whether the lung ultrasound is looking better or not from one exam to the next? Are you...
Professor Chao, how about your opinion about this patient, this problem? Just like lung ultrasound, maybe in the very beginning is routine, and maybe combine the lung ultrasound and the CT scan, and it's very important to combine.
Yeah. In my opinion, keep some image in your mind is very difficult, but I think all these kind of machine have some memory stick or the memory hard disk here, so we can store this kind of image inside, and also type some patient's information inside the machine. And if you want, you just record in the same protocol. You use, as we mentioned, in Chinese we use CCUE protocol to record all this kind of image, and also some thing about the patient's disease. So when you want to compare the different image or patient's condition, you just record this kind of images, put them together. I think you can compare in the very detailed.
I agree with you. In my opinion, this epidemic of COVID-19 give us lots of chance to know the detail of the lung ultrasound. Just like it's because the coronavirus, the new coronavirus, this virus can infiltrate very deeply to the pleural, and then and alveolar, the valve, the lung valve, maybe the small lung valve and the big lung valve, and the bow of the lung, and one by one, so we can see the lung ultrasound play an important role in these patients. Then we think what I mentioned in the past. We think the lung ultrasound maybe ignore the detail, ignore the detail, the lung injury. But in these patients, especially the epidemic of the COVID-19, we can use the ultrasound to find lots of very detailed and very small lesion of the lung injury. Very little, very small. So I think when this epidemic of COVID-19 is past, lung ultrasound will be pay more attention. We would like to pay more attention about the lung ultrasound, about the science and the basic, and then the clinical application. So I think lung ultrasound will get stronger in the critical care in the critical care practice. It's my opinion. Thank you.
Absolutely.
Thank you. Thank you. Yeah, no, that's very, very interesting. And that, you know, there's still so much to learn about lung ultrasound and how we can, already you're seeing very, very tiny, tiny details in the pleura and the alveola, but there's still much more for us to learn.
Yeah.
I want to transition a little bit to fluid management. I know that it's very important for you to manage the patient's fluid status very carefully. And I'm wondering how you use lung ultrasound to do that. Are you looking at the IVC? Are you looking at the cardiac VTI? Or do you use lung ultrasound to help you with the fluid management?
Yeah. Maybe I think you are ICU doctor. Maybe you have a background of ICU doctor.
I wish I.
Maybe Professor Cao can.
Okay. I'll take the question first, and maybe Xiaoting can give some comments or something. Okay, I think the first, if you are from your lung ultrasound point of view, you know, this kind of image is our ultrasound machine just can give us some kind of useful image. So based on this kind of image, you will combine this, or we just think about the pathophysiological part of the patients or the disease. So, you know, from the lung ultrasound, we have A line, pleural line, B line, B7, B3, or even diffused B line, and the others, some consolidation, shred sign, or tissue sign, or even the airway broncho signs, something related to the image. But try to think about this kind of image combined with the disease or the cause of the disease. So in the very early phase or early stage, the patient's, the clinical sign, just short of breath, little bit oxygen situation lower than normal range. But in this phase, most of the patients have maybe running nose and cough and fever. But during this phase, most of the patients, something happened with the lung is some interstitial syndrome. So we call the GGO, the ground glass opacity. And after that, after that, when you see the patient's condition is more severe, more high fever, very low oxygen situation, some of patients, what happened in the lung is maybe a little bit pleural effusion or lung consolidation, or from maybe one lobe from the others, more diffused. So I think we can use this to try to stratify or grade different patients to the maybe very moderate, mild, or very severe. I think this is, we use the lung ultrasound and even compare different phase, different days we gathered from the patients, the images. And if you want to manage a patient's circulation and also the ventilation or respiratory system and also circulation system, you have to put this kind of information together. From the pathological point of view, we think about the hemodynamic part and also respiratory part. So we combine the image from maybe from a subcostal part, from the four-point view, four-chamber view, IVC, or the apical part, the four-chamber view, something like that. And we see the shape or the movement of the heart, and also the ratio, the left and the right ventricle, the shape and the dimension, and also we see the systolic function. And also, if you want to combine this image with the hemodynamic condition, you try to measure the IVC, measure the VTI, something you can gather some information about CO or the stroke volume.
Mm-hmm.
So we use this image and try to think about the hemodynamic condition, and based on this kind of information and also patient's problem, and then we give some decision making and give some kind of intervention to help patients. So from I think this kind of part is still is static management or static hemodynamic management. And also, if you give some a little bit intervention like minimal fluid challenge, or give something with ventilator setting, or adjust this kind of a setting. The other thing, I think we try to give patients the dynamic intervention to see what kind of hemodynamic condition patients have, or what kind of fluid you can give the patients, or fluid challenge, or diuretic drugs you should give patients. I think this is my opinion, to use lung ultrasound and also critical ultrasound to manage our patients.
Okay, that's very interesting. So if I understand correctly, then in some cases you will actually give a minimal fluid challenge or change the ventilator settings, and to see whether or not you should give them more fluids. And in those cases, then to determine that, do you look at the lung ultrasound, and you also check the heart, looking at the stroke volume and cardiac output?
I have some opinion about this problem. I agree with Professor Cao's opinion. But I have some opinion about this patients, about the problem, because the COVID, especially critical COVID-19 patients, is a little different from the traditional septic shock. Maybe very different, because in the mild and moderate patients in the beginning, in the early stage, maybe the moderate stage of the patients, lots of patients got a lung injury from the epithelial cell about the lung valve, the very little lung valve of alveoli. So the patient's the lung exudation and the infiltration is not very severe. Especially there's a little fluid leak. Leakage is maybe is mild, moderate, not very severe. In the maybe patient got severe and severe, the fluid leakage is very severe, because the patient's lung, maybe the capillary endothelium cell injured. So the fluid leakage is very severe. So in the different stage, maybe the fluid management strategy is different. So in the very beginning, in the mild and moderate patients, maybe we pay more attention to the lung ultrasound, the lung injury, and then the fluid management is very important in the severe patients. Maybe in the last stage of the patients. So in all the different period of the patients, fluid management, maybe key alert, key and clear brain for a patient. Fluid management is accurate and correct. So just like what the Professor Cao mentioned, IVC and fluid challenge, and then fluid responsiveness, and then fluid management is very important in all of the patients. Thank you. It's my opinion. For different stage, and the different management strategy about the fluid management. Thank you.
No, thank you. Yes, thank you. That's very interesting. Were there other ways that ultrasound impacted your management of COVID patients? You did mention looking at the organs, like the kidney and the liver.
How about the Chao?
Okay. So you know, in this kind of a disease, the pathological part tell us during this very low oxygen situations, so the other organs were damaged. So we also focus on the, you know, some papers published, some things related to kidney and liver and even the heart. So we try to use the critical care ultrasound to focus on this part. You know, during the kidney management, we use in this way we use some things. The first is the real image, and also the color of the blood, and then some Doppler function to see what is the resistance index or something like this. And also you use some dynamic things, repeat this kind of examination, repeat your intervention to see what happened, what changed with this part. So I think combine this kind of information with the whole hemodynamic management and also respiratory support treatment, I think it's more useful to help our patients. And the other part is the heart, I think, is our heart or cardiac ultrasound is more useful. I think it's we don't need to try to how to say this machine is more useful. I think it's very useful. It's most doctors to know this very deeply. So this is my opinion.
I would like to point out about the organ injury, maybe extra lung and extra heart, about kidney and the liver, maybe the intestinal. I want to point out the organ injury, maybe in the last stage, especially in the critical COVID-19 patients, because there's no very accurate evidence about the kidney and maybe the heart, and then the intestinal and the liver. The virus can injure this organ and directly. So I would like to point out, and then the organ dysfunction is a secondary injury in the critical COVID-19 patients, especially in the ICU patient got the traditional sepsis, not the virus sepsis, traditional. So it's this problem, this issue, we need to pay more attention to. It's often a secondary injury. So it's very important in every ICU doctor's brain. It's a secondary injury. Thank you. It's my opinion.
Okay, thank you. So yes. So what I understand is that looking at the organs, the kidney, the liver, and of course the heart, is very important. And the COVID-19, because of low oxygen, will affect those organs. And for the kidney, you actually look at it with imaging, with color, with Doppler, and you measure the resistive index. But I think the second point was actually that even in traditional sepsis, this secondary injury is also very important, and we need to pay more attention to it. Is that correct?
Yes.
Oh, great. Thank you so much.
Yeah.
Are there other
Some
specific,
question?
oh, just a little bit. Are there other specific features of your ultrasound system that you would want to comment about?
Sorry, I didn't get your word.
Is there anything else with about ultrasound that you would want to comment about that we didn't discuss already?
Okay, so I think the last question is about some organ dysfunction. We also should mention the cerebral part. You know,
oh, okay, yes.
Some doctors mentioned the virus also some evidence telling us it's damaged the brain. So in our team, there's some experts to use this machine to manage the very severe brain damage, like real image and some color Doppler, the power Doppler to measure the MCA or the PI, RI, this kind of things. And also we use ONSD to see the dimension of the shade of the nerves, I think the shape of this. So this part also very important in this kind of disease. So this is one question. And the others, I think you asked, you know, in a venue machine now, you use some very interesting function like automatic VTI or B lines. I think it's very useful. It's more easy or save our time to try to, you know, in the COVID-19 patients, the medical staff have to wear very, very heavy clothes. You have to wear maybe face mask and lots of gloves, even not only one time, it's 3 layers of this kind of glove. So to measure something, to do something in very, you know, it's very difficult. So
yes.
You use this kind of automatic function is not only save time, also save a lot of energy for all these kind of steps. I think it's very useful.
It's my opinion too. Thank you.
Oh, thank you. That's very interesting. You know, I can imagine that wearing, you know, when you're preparing yourself, you know, for protection and wearing all of the layers of 3 layers of gloves and the face mask, it must be very draining of your energy. So I'm so happy to learn that something that we built in the auto VTI and the auto B lines is helpful to you and will help save some of your precious energy when you're caring for these patients.
Yeah, the venue have lots of auto technique. It's just the time. It's just the time. It's got the exact time, right technique, and the right patients. So congratulations to you.
Yes.
Oh, well, our goal is to help physicians like you, and you're the real heroes who are making the difference in saving lives. And so if anything that we can do and to help you we're very grateful for, and also grateful just to have a time like this to really learn from you so that we can think about how we can help you, you know, more in the future.
Yeah.
Okay, thank you. You know, as a doctor, I think this is our responsibility to save life in this kind of pandemic. So we have this kind of responsibility. So we have to do this.
Oh, thank you. Thank you, and thank you very, very much for your time tonight. I know you know you have spent so much energy and taking care of the patients, and then actually even beyond that, it's thinking about it and learning, you know, from each other, and then the energy even that it takes to share what you've learned with the rest of the world, because you faced it first, and you know, I think everyone else is so appreciative to learn from you, and so that we can push through and learn how to help these patients.